This poster is about Autism Ontario's OAP Service Navigation Program. The information shared is derived from an external arm's-length program evaluation completed by McMaster's Centre for Health Economics and Policy Analysis along with the McMaster Autism Research Team. Self-directed funding for autism treatment came to Ontario in 2019 when the Ministry of Children, Community and Social Services introduced its new Ontario Autism Program, OAP for short. Under the OAP, eligible families are allocated childhood budgets to directly buy the evidence-based services they need for their ASD family member. Families with autistic children up to age 6 can receive up to $20,000 per year, and those with children 6 to 18 are eligible to receive up to $5,000 per year. Such self-directed funding is a person-centered approach designed to diminish wait lists and empower families. It gives people more choice and it permits the development of tailored supports, but at the same time it comes with added demands on families. For example, people have to find out about the process in the first place and complete an application, which may feel time-consuming or stressful, especially if people are juggling extra demands related to ASD or if they're overwhelmed by a recent diagnosis. And then there is the key consideration of equal access. Linguistic, cultural, or socioeconomic barriers can all make it harder for some to access such a program. Research indicates that low-income and minority children are already often diagnosed later, and on top of that, they also experience more delay in initiating treatment even after they get the diagnosis. So it's important that these families are not further disadvantaged by the funding model itself. Therefore, the Ministry of Children, Community and Social Services provided funds to Autism Ontario for the Service Navigation Program. Service navigation is an evidence-based intervention where knowledgeable experts help people to navigate complex care pathways. It improves outcomes by helping people find services faster and by making access more equitable. 18 navigators are spread across Ontario, covering rural regions as well as more populous areas. Many are multilingual, and there's at least one French-speaking navigator in each region. The program includes also 5 additional team members, such as a supervisor, an intake specialist, and an outreach navigator. This navigator is not assigned to any one region, but instead focuses on how to link with underserved populations across all regions. And the final chunk of staff support comes from 6 regular Autism Ontario staff that devote some of their time to service navigation. Leveraging existing staff at Autism Ontario has certainly helped to get this program up and running quickly. Next, I'd like to talk about how the program operates. As intended, the program helps people to learn about the formal OAP supports, but it's also more than that. The Service Navigation Program also aims to build other support networks between families themselves and between agencies to support the growth of community capacity. To achieve these program objectives, the navigator role has 4 main components. First, navigators give families information on how to access the OAP and other formal services. The information is given individually or through group-based childhood budget workshops. In addition, there are webinars and written materials in many languages. In the 9 months evaluated, service navigators gave 263 childhood budget workshops attended by 1,200 parents. But formal supports are only one piece of the pie. Informal supports that come from connecting with other families are important too. Families who have an autistic member might be more isolated because of not attending community events due to concern about sensory issues or feeling judged by others who don't understand autism. Therefore, service navigators also plan and run social learning opportunities. These are free recreational events exclusively for families that have a child on the spectrum. And furthermore, the whole family is welcome to attend. This may include activities such as an exclusive showing of a movie at a local cinema or a specialized yoga class at a community center. Over the 9 months evaluated, 362 recreational events were attended by 4,800 children with ASD, 3,800 adults, and 2,250 siblings. The third element of the navigator role is networking with local agencies. Navigators must know the local service landscape in order to better help families to link with services. Also, navigators help other agencies to learn about the OAP, and this in turn extends the impact of the service navigation program by allowing others to help their clients. In addition, navigators help community agencies learn about autism more generally through webinars or training events, and this in turn helps local organizations more comfortably expand their programs to include children with ASD. For example, a karate school may offer some additional spots for children on the spectrum. The fourth element of the program is data collection. A good computer infrastructure has been developed to capture what is being done, for whom, and how long it takes. The service navigation program had been running for 9 months when COVID hit. On March 17th, all in-person events were cancelled, but families stayed connected. Autism Ontario surveyed families about pandemic challenges, and the main concerns were service loss, finding things for their family member to do, establishing new routines, and parent stress. Therefore, the program pivoted and added more online support groups and virtual OAP navigation sessions. Navigators partnered with local businesses to create and deliver home activity kits. For example, there were pottery kits from Crockadoodle Pottery or donut decorating kits from Tim Hortons. Navigators continued also to connect with families by telephone or online. In this next section of the poster, I'm going to walk you through a typical service navigation journey. First, families might find out about the program through the Autism Ontario website, the ministry website, or from multimedia outreach campaigns. A majority then complete an online service navigation form at the Autism Ontario website, but people can also call the intake specialist or contact their local navigator directly. The intake specialist receives the completed form, dispatches it to the correct navigator for follow-up. The navigator then provides the family with information on autism resources. This includes the Ontario Autism Program, as well as other resources within the community. Half the families, 48%, wanted general information on the OAP, 9% had very specific OAP questions, and the remainder connected for a range of reasons, such as respite, school, transitions to adulthood, crisis, camp information, or general information on autism. Next, the navigator assists the family with goal setting. Afterwards, the navigator facilitates linkage to those supports which are tailored to the family goals. This could include community resources, workshops, or webinars. Families then go on their way, having been empowered to access the formal service systems and becoming aware of what is available within their community. This program is not intended to be a long-term support. Furthermore, the program itself does not include things such as service planning, case management, clinical support, or behavioral services. The program has nothing to do with eligibility, waitlist management, or distribution of OAP funds. It's a bit different from the kind of service navigation that might take place within a hospital or some other organization, because the navigation comes from a group that does not themselves provide OAP-funded services. This certainly has an advantage because it avoids the potential problem of families feeling like they should buy service from a group that explained how to attain the funding. So the program is meant to be time limited and it sits outside of OAP. It ushers people in, and then once people receive a childhood budget, they may wish to reconnect with their navigator. Navigators can then help families to understand what types of services would be eligible for funding and how they should report their expenses. To gauge program effectiveness, an arm's-length external evaluation was completed by a group of researchers at McMaster University's Autism Research Team and the Centre for Health Economics and Policy Analysis. The evaluation covered the 9 months between July 1, 2019 and March 2020, when the program was fully operational but COVID-19 had not yet come into play. 2 types of data were utilized. The first was the thorough and extensive information collected by Autism Ontario on the number of clients, services provided, and client satisfaction. Secondly, the research group conducted an online survey of navigators in order to gather information from people at the front line as to what works well and what could be tweaked. This poster touches only on the highlights, but the full report is available online. 4,046 unique families were served through one-time consults, childhood budget workshops for groups of parents, social learning opportunities, and community events. 90% of families surveyed indicated that they were either satisfied or very satisfied with their experience. 208 of the families had French as a first language. On average, it took only 4.2 business days between the time a family completed the service navigation request form and when the navigator connected. The first contacts averaged about half an hour. The response time is very quick, particularly in light of the fact that there are often long wait times within ASD services. Information about the Ontario Autism Program was provided in a total of 21 different languages. 17% of the families served had a first language other than English or French. In Ontario, 3% of people speak a language other than English or French as their first. So, contact with this group clearly exceeded the population base rate. In other words, outreach efforts targeting families with language barriers were clearly successful. The graph on the right gives you a sense of the sheer magnitude of the program. About 5,800 parents and children with ASD accessed either community events or the more formal budget workshops. The Service Navigator survey revealed generally high job satisfaction and levels of training and supervision which were very well regarded. Navigators were of the opinion that families generally felt less stressed and more empowered after connecting with their navigator. Regular cross-provincial virtual team meetings were noted as a real program strength because they allowed people to share resources and ideas between different regions, thus building up a better, smarter system. Navigators made many clever suggestions as to how to enhance the program's reach and effectiveness. For example, navigators noticed that there is not a direct link between the diagnostic hubs on the service navigation program, and this might impose an unnecessary delay for families trying to find out about services. Navigators felt that online supports were working well and suggested that these should be retained in future. Although service navigation is explicitly designed not to provide case management, A number of navigators noted that this nevertheless did occur with a proportion of their contacts. Therefore, navigators suggested that it would be important in future to develop some solutions or pathing mechanisms for families who do need case management. Also, navigators noted that certain regions may require more navigators in order to fully service the population. In general, navigator feedback has been aggregated and will inform the program's development going forward. In conclusion, this program has rapidly established a fast and easy way for families to learn about, apply for, and use self-directed funding. It has also established effective means for overcoming linguistic and cultural barriers so that service access is fair and equitable. Placement of the service navigation program within Autism Ontario means that additional supports beyond formal services can be discussed and offered and built upon. Future directions include expanded translation, the implementation of a survey in order to gather family feedback about the program development, and establishing a link to families at the point of diagnosis so that service navigation may proceed sooner. The established best practice model offers exciting possibilities for implementation in other provinces or across Canada as a whole.